Hello, I'm going to be talking to you about clinical psychology. My name is Greg, and I am a second year PhD student in clinical psychology at UWM. So, clinical psychology is understood as an integration of science, theory, and clinical knowledge. At its core, it's designed to relieve psychological distress and dysfunction and also promote well being in those that we work with. So, clinical psychology is unique among the different branches of psychology in that you're going to be working at the intersection of a number of different areas. So, as a clinical psychologist, you would learn and be able to integrate findings from things like developmental, cognitive, behavioral, social, and personality psychologies. It's pretty unique in that it draws from a number of different areas to make a synthesis of how to actually help the people that we work with. So, a degree in clinical psychology can be extremely flexible, and that degree in clinical psych can offer opportunities for both teaching, research, and also clinical practice. So, with a degree in clinical psychology, you can pursue something more academic, like teaching at a university, working in a research lab as a principal investigator, or conducting research at an academic medical center. You can also pursue clinical practice in a number of different areas with a number of different populations. So there are opportunities to work as a clinical psychologist in hospitals, specialized clinics, private practice, and many people actually split their time between clinical practice at major academic medical centers while also teaching things like medical residents or psychological trainees. So there's a few different types of degrees that you can pursue if you're interested in clinical psychology. The first is a master's degree. So these are 2 to 3 year degree programs. The benefit of having a master's degree is that you can use it to make yourself more attractive to doctoral programs, which are notoriously competitive, as well as make yourself qualified for administrative work in different research settings. So often study coordinators or grant writers might have master's degrees, but keep in mind master's degrees are not prerequisites for applying to doctoral programs. So there are two types of doctoral programs in clinical psychology. The first is a PhD, which is much more research based. It's a 4 to 6 year program and then a 1 year APA accredited internship. So your time in a PhD program would be largely focused in learning research and theories involving clinical psychology, but a PhD in clinical psychology does open up the avenue for licensure and practicing. And then the second type of degree is called a PsyD. So it's also 5 to 7 years, so 4 to 6 years in a university and a 1 year internship. These focus much more on professional practice, and most people with PsyDs are interested directly in working with clinical populations. And notable point is that PhD programs are often funded through undergraduate tuition, so you would actually be paid a stipend and not incurring any more debt from tuition, whereas PsyD programs charge tuition similar to medical school. There are some core requirements for applying to clinical psych graduate programs. The first is a prerequisite is usually undergraduate coursework in psychology. This includes things like statistics and research methods, which are particularly important if you're applying to PhD programs for clinical psychology because they have a research focus. GREs are often required, especially for doctoral programs. You'll need recommendations from professors, employers, and supervisors, hopefully in the fields of psychology. And also, you'll need a personal statement talking about your interests, your background, and what motivates you to pursue the degrees. So, the experiences you'll have as a practicing clinical psychologist can be pretty varied, really depending on what you're most interested in and the kind of training that you pursue in graduate school and beyond. So, as a clinical psychologist, you'll receive training and a broad introduction to a number of different areas. So, you might work on things like assessment, such as neurocognitive or neuropsychological assessment, intervention if you're interested in being more of a practicing psychologist. And then from there, you kind of work backwards on what you're most interested in. So, in terms of research, supervising students, and teaching, if you would like to be more academic, Many clinical psychologists actually pursue management and administration at larger research institutions like medical centers. And of course, there's advocacy for different underserved populations and different ideas within the field. Life as a clinical psychology graduate student is fairly busy, mostly because in addition to your research as part of your PhD, you're also learning how to do practice and develop expertise in different kinds of clinical areas. So, as a clinical psychology graduate student, you would be exposed to, again, core psychological coursework that you might have taken in undergrad, such as psychopathology, statistics, and research methods, as well as more specific coursework for clinical psychology, such as foundations of psychotherapy, professional ethics. So if you pursue a PhD, research is a large part of what you'll be doing, and you're expected to complete a master's thesis, preliminary exam, and a dissertation, as well as pursuing professional development at conferences and presenting your research. In addition, at UWM, there's an in-house psychology clinic that you would be trained in for things like assessment and psychotherapy, as well as completing 1 to 2 years of an externship. So you would be working at a local mental health center, such as a VA, an outpatient clinic, or even inpatient mental health treatment. If you have any questions, feel free to contact me. My name, office, and email address are listed here. The application process to these programs can be a little confusing, and figuring out which degree is right for you can be tough. So if you have any questions or you need any guidance or insight from people who have been through this process, feel free to reach out to me. And also look into the links that are provided below. So there's some good information in terms of the history of clinical psychology, their role within APA and how it's governed, and some more information and detail about the different kinds of activities you would be conducting as a clinical psychologist. But it really is an amazing area of work. You would have the opportunity to really help people with a lot of different kinds of problems, and the degrees offer a lot of flexibility. So there's a lot of room for growth professionally and personally. So good luck.